Welcome to Wednesday's edition of COVID-19. Korea has recorded an explosive rise in new infections today with well over 2,000 cases. And against this backdrop, interest is growing over the role of one's immune system in warding off the risks of COVID-19. Now, we have details lined up later on the program. Here first is the broader pandemic coverage with our Kwon So-ah. Now, so let's begin with the unsettling surge here on the local front.
Right, Sunny. For the first time since Korea's first COVID-19 case broke out in January last year, daily infections have climbed above the 2,000 threshold. And this amid a faster spread of the virus across the nation due to the summer vacation as well as the fast-spreading Delta variant. President Moon Jae-in this Wednesday called the situation a critical point. So 2,223 is the figure we're seeing as of 12 a.m. this Wednesday, and we even topped the 2,000 mark already on Tuesday night at 9 p.m. So domestic infections alone now stand at 2,145, and with that, Korea has surpassed 216,000 cases in total. Now, cases have in particular jumped in the capital Seoul here, more than around 300 more cases than yesterday, and also Gyeonggi province seeing the highest caseload at 666, triple digits here in Busan and Gyeongsangnam province, and also a surge in the Jeju-do Island, that is. So this Tuesday, the proportion of cases in the capital region has risen again, now standing at 65.5% as of 12 a.m. and this when it comes to domestic transmissions. So let's see how daily cases have been developing over the past week. Now we are seeing this huge jump from yesterday by some 680 cases. And when we take a look at the Wednesday figures, we did have a slight decrease here last week after resurging figures for many weeks. But now it looks like that obviously was no time to be relieved, as we are seeing this jump now. And that is why experts are saying we may have not reached the peak of the fourth wave as of yet. And also that is while stronger antivirus guidelines than the existing four-tier social distancing scheme are not being considered yet, officials do stress for higher vigilance as well as enhanced efforts by the government as well as the public.
지금 4차 유행을
The best way to contain the fourth wave is to refrain from gatherings and traveling. Our healthcare capacity, such as the number of vacant ICU beds, is gradually dwindling. Treatment could become a challenge if the number of patients increases further and the current situation is prolonged.
Park said the government hence is responding with extra containment measures to protect those at the highest risk. Citing recent cluster outbreaks at nursing homes and hospitals involving breakthrough cases, authorities ordered regular preemptive PCR tests at such facilities regardless of vaccination rates. For places under level 4 social distancing, that would be once a week, at level 3 once every 2 weeks. Also, no hospital visits will be allowed at level 4. Authorities are also issuing more recommendations for public servants as well as private businesses, calling for more remote working, staggered working hours, refraining from business trips, as well as getting tested for COVID-19 when returning from vacation or even before going to vacation spots and various accommodations. Now, raising the vaccination rate is also one of the focuses that the government is currently focused on, mentioned by officials today. Now, while regular citizens aged 18 to 49 continue their reservations for their inoculations, so far we've got 8 million people in the country who have been fully vaccinated. That's equivalent to 15.7%.
Right, so meanwhile, on the international front, I understand the Delta variant is challenging herd immunity efforts.
Right, Sunny. Israel, for instance, despite its fast vaccination, which includes kids as well as booster shots for its elderly citizens, is seeing some 6,000 daily cases, which is one of the highest figures since February. And also a top vaccine expert in the UK, meanwhile, even made a frightening assessment that due to the fast spread of the Delta variant, herd immunity is not a possibility. Now, let's take a closer look at the figures abroad. As we just spoke about the UK. We see 6.1 million in the UK with some 23,000 new infections and a six-digit increase in the US in the past 24 hours, over 111,000 new infections. We're also seeing resurgences in Iran with almost 40,000 new cases in the past 24 hours as of noon Korea time. And the daily increase around the world here, we see over 643,000 infections, raising the total to 204.7 million. And those are the updates I have for now. Back to you, Sunny.
All right, so thank you for now. I'll see you on Thursday.
See you.
Right, back on the local front, public response to the revamped online vaccine booking system has been relatively favourable. And for more on the technology behind it, I have our G. Abby Lee here in the studio. Welcome back, G.
Hi, Sunny. So as you know, securing a vaccine appointment is something that's highly sought after here in Korea. With online registrations now available to more than 60 million people in their 40s and below, the government and industry insiders have been focusing a lot of their efforts on the right infrastructure. In today's segment, we'll talk about how the Korea is doing to optimize its vaccine booking system. Let's first hear from KDCA Director Lee Sang-won from Tuesday's briefing.
Vaccine-eligible residents between the ages of 18 and 49 can book their appointments more quickly if they download their digital authentication certificates in advance via Naver, Kakao, or the Pass app, at least a day prior to their bookings.
Prior to the adoption of a 10-day rotation system, there have been some technical issues that made reservations difficult for some users. For example, foreign teachers who had been eligible as part of the government's inoculation drive in the education sector were unable to book their vaccines. This is because the system failed to recognize their alien registration card numbers, which led to some negative press for the KDCA website.
Right, G. Meanwhile, the gist of the current rotation system, G, is to disperse user traffic, right?
That's right. So that's one part of the puzzle, but the other part was restructuring the online infrastructure on the back end. LG CNS, a local IT services firm, told local media outlets that KDCA contacted its architecture optimization team for immediate assistance following the last month's mishap with the booking. For 5 days from July 23rd, the company's system architects worked on resolving 90% of its bottleneck. The biggest stumbling block was data-driven. The system took too long to fetch the list of available hospitals and inoculation dates after an applicant went through the verification process and attempted to make a reservation. The LGCNS team explained it reduced the data load to about 1/10 and improved the quality of the servers. Through this procedure, the service can now handle 2 million users per hour from the previous 300,000. The Social Security Intelligence Service, in charge of improving the vaccine appointment system, said the LGCNS team has played a leading role in the problem solving. The team is made up of IT experts specialized in dealing with systems overloads and unexpected events ahead of launching a new system.
I see. Now, once you've booked the first dose, G, correct me if I'm wrong, the second appointment is automatic, I hear.
Automatic, right.
I see. Now, with the date set, that is, I suppose vaccine supply will determine the success of our inoculation drive.
Right. As you know, we covered last month that there is some unspecified production issue with Moderna, so that adds to some uncertainty. Here is how KDCA Director Lee Sang-won explained it.
The vaccine supply situation remains fluid, and there may be changes in the inoculation date and the type of vaccine available if there are any disruptions in the delivery schedule. We will promptly inform the public of any changes should they occur.
Now, despite the production setback, Seoul is sticking to its initial goal of vaccinating some 70% of its population with at least one dose by the end of September.
Gee, beyond Korea, how are countries elsewhere making use of their cyberspace to address the pandemic?
Many industrialized countries are investing its infrastructure to make the online and infrastructure very safe. For example, Italy's Lazio region, home to capital Rome, suffered one of its worst cyber attacks since on an Italian public agency to date. Earlier this month, hackers attacked and shut down the IT systems of a company that manages vaccine appointments for Lazio. The regional government said all systems had been deactivated, including those of the region's health portal and vaccination efforts, and warned that the inoculation program could suffer a delay. In the United States, Google reportedly furnished the Department of Defense with cloud software and artificial intelligence tools to help the agency deal with the pandemic last year. Under the $2.5 million deal, Google's partner Carahsoft provided the tech giant's cloud and AI tools to the U.S. Northern Command, a major DoD instrument for its homeland security efforts. That's all from me today. I'll be back same time next week.
All right, Jay, as always, thank you very much for the coverage.
Thanks for having me.
Right, meanwhile, over in Greece, authorities there recorded an alarming rise in daily infections earlier on Tuesday with over 4,000 cases. But further aggravating attempts to better address the pandemic are wildfires that have been raging in several parts of the country amid its worst heat wave in 30 years. For more, I have Pavlos Katapantaitis live on the line. Welcome, Pavlos.
Thank you for having me.
Pavlos, let's begin with these frightening flames. How and where did they start?
This is not about one fire. In the first week of wildfires, so since from August 3 to August 9, there was a total of 586 fires that started in the country. One of the main reasons for this is that in the days prior to that, we had, as you mentioned, the biggest heat wave of the past 35 years. In the country. As a result, the woods have become drier. It's easier for a fire to start. It's easier for a fire to propagate very fast. And this is combined with the fact that many fires are catching up in the same time, making the rescues work like very hard.
Right. I also understand thousands of people, Pavlos, have been displaced. How are they being accommodated and what has been disclosed about the damages incurred thus far?
So as the fires are still raging, we're not so much in damage assessment mode, if not for the island of Evia, which literally the northern part has been burned from seaside to seaside. Like it's quite amazing. The people that are being dislocated from their homes are being, for the most part, hosted in the hotels that are closest and safe. This is the main way to do this, as it makes it easier to find natural places to relocate them. However, overall, this has been becoming a kind of a problem in regions like Evia, which is continuously burning. There is no safe place close to the burned places, so some people have been living on boats for a few days. But again, we're not in damage assessment mode yet. We're still dealing with the fires. It has to be said that there has been only 2 dead people, and they were rescuers that didn't burn alive, which is progress for Greece in the sense that there were 102 dead people in 2018 with fires that were much smaller. So there is some positive silver lining, if you will.
I see. And talking about dealing with the fires, Pavlos, neighbouring countries have joined Greece's efforts to put out the blaze. How has there been any tangible progress on that front then?
Well, overall, it's a bit of a game. Overall, we have received help from several European countries, obviously Britain, France, Slovakia, Romania, Czech Republic, and I apologize for all the countries that I'm not mentioning that have been sending their best men to deal with this. We've also received help from the United States, from Qatar, etc., etc. Now, this morning we received a second big firefighting plane from Russia that is able to drop more water than the regular planes we have. But this is like such an emergency situation that there isn't just enough airplanes, there aren't enough troops on the ground. And you have to understand that as Greece has a lot of mountains, there are fires starting in places where you can drop water from a plane or from a helicopter, but are very hard to access by actual land firefighters, which is essential. Like for a fire to be stopped, you really need airplane and ground forces to be coordinating.
Of course. Pavlos, in a rather shocking turn of events, I understand a few arrests have been made in connection to some of the fires. Could you tell us more about this?
Absolutely. So this is shocking for anybody outside of Greece. Greece has been dealing at least since the 80s. With that destroy the forest. And after a few years, in some of those forests, houses and villas will pop up that are obviously built without a building permit. But the way Greece works, which is weird for many people from other countries, even those houses built without permit within 10, 15, 20 years will become, will have accepted permits, they will be given electricity, and they will become legal after the owners pay some huge fines. So over the years, one of the problems of the wildfires is that they're man-made, part of them, not all of them, obviously. There have been 4 arrests in the past few days. 3 people have been put into jail waiting for trial. But the problem is so severe that the legislation was changed in 2019 to give harsher sentences to the people putting the fires.
I see. And this hasn't discouraged the acts completely, though.
Nobody knows. Every time it's like whoever the government is will claim that most of the fires were due to arson, and whoever the opposition is will say, no, this is governmental incompetence. It's very hard to find out what's really happened, especially after the forest burns down. There's not much to see, you know. You can only catch the arson before it happens, or at the very start.
Pavlos, now I can only assume such natural disasters are further challenging COVID-19 containment efforts within the country. Would you agree?
Well, I would say we don't even pay attention to that anymore. We're in an emergency situation. This is like a war zone. Like it's more important right now, as hard as it may sound. Like it's more important dealing with that than dealing with COVID. Now, Greece, however, is very, very advanced in the vaccination process. We have almost 6 million people out of a population of 10 million that have been fully vaccinated. We've now opened vaccinations to people from 16 to 18 years old. And there's roughly 20% of the population that just doesn't want to vaccinate. As you mentioned, cases in the past few weeks are up, but as in most countries, severe cases are not as many as they were before the vaccination. So you have a lot of people with COVID, but less people than you'd expect that die from it.
I see. Well, that's good to know. All right, Pavlos, thank you very much for making the time to join us live at this hour with your thoughts. Right now, in response to current social restrictions amid the 4th wave here, a number of beaches have been closed to the public, including those in the southern port city of Busan. Nevertheless, for those looking to enjoy summer water activities elsewhere, here are a few important facts to ensure a fun and safe experience.
To prevent infections, this water leisure park in Gapyeong manages visitors using the Safe Call Access Control Service and frequently makes announcements on quarantine rules. Common use items are thoroughly disinfected as well.
매번 이용객들이 이용하시는 손잡이라든지 보트라든지는 저희가 소독제 갖다가 꼼꼼하게 다 닦고 있고요. 레저시설 이용하고 난 다음에 마스크 필히 착용하라고 그렇게 말씀드리고 있고.
Following individual level quarantine rules are also crucial. You're required to keep a certain distance from others during rides and should keep masks on whenever outside water. When masks get wet, they may become difficult to breathe through, so you are advised to change them to a new one. There are waterproof masks on the market though. Their efficacy and safety are yet to be verified, so you should take precautions when using them.
In July, as there was no sign of a let-up in the 4th wave of the pandemic, the South Korean government adopted its toughest level 4 distancing measures ahead of peak holiday season.
Following its decision to keep the level 4 distancing measures in the capital area, the government raised the level for all other regions uniformly to 3. Starting yesterday, the 10th, the Busan metropolitan government implemented level 4 distancing measures, prompting all beaches in the city to be closed. With this, visitors to all beaches across the country are required to submit an entry log and should wear safety bands and temperature stickers that change color according to body temperature. The same rule applies to valleys too. To enter the valley, you must have your temperatures checked at the entrance and have a strap that confirms that you checked the safety rules. As for swimming pools, they are closed at 10 p.m. According to the current quarantine rules, masks must be worn outside the water but can be taken off in the water. However, some worry about the risk of contracting the virus from the pool water.
물 안에서는 코로나 바이러스에 감염될 위험은 극히 적다고 볼 수가 있습니다. 우리가 수영장에서는 염소 소독을 하기 때문에 바이러스가 거의 생존을 할 수가 없고요. 바닷가 같은 경우에도 원체 물이 많고 순환이 빠르기 때문에 바이러스가 생존하기 어렵습니다.
Still though, it is unlikely to contract the virus while swimming. But you could still catch or spread the illness if you're clustering around others above water, on the pool deck, or in the locker room.
결국은 우리가 마스크를 잘 착용할 수 없는 상황을 피하는 게 제일 중요할 것 같습니다. 그래서 이번 휴가는 기본적으로 가족들과 같이 좀 조용히 휴식을 취한다는 생각으로 하셔야 잘 쉬고 또 위험성 없이 보내실 수 있을 거라 생각합니다.
Summertime is always the best that one might be, and there are so many cool ways to beat the heat. And to make the most out of it, we should always follow quarantine measures to keep ourselves safe from the virus. This has been 신세변.
전국적으로 감염이 확산되고 있는 현 상황에서 백신 접종을 통해 하루빨리 집단 면역을 형성하는 것이 위기를 극복을 위한 근본적인 해답임이 분명합니다.
Asymptomatic versus symptomatic, mild symptoms versus severe conditions. Now, all these physical states of COVID-19 infections are more or less reportedly affected by our respective immune systems. For more on our natural defense mechanisms against diseases, I have Professor Yu Byung-wook from Suncheon University. Welcome back, Professor Yu. And I also have Professor Pamela Song from Inje University. Good to have you with us, Professor Song.
Thank you. Thank you for having me today.
And joining the session virtually is Dr. Ravina Kular at the Infectious Diseases Society of America. Pleasure to have you with us, Dr. Kular.
Thank you for having me on.
We'll start here in the studio then. Professor Yu, as is the case with most other illnesses, it appears that pre-existing health conditions and old age render an individual that is, particularly vulnerable to COVID-19. What more can you tell us?
Well, as you know, the aged people, they have not enough immune systems. That's why they are very vulnerable against the COVID-19. So diabetes, one of the representative disease, is depend on the immunities. Who out of control with diabetes or serious disease complication from diabetes, they are suffering with the COVID-19 more. But these days, unexpected use, less than 40 years old who got it the COVID-19, who got a serious, which means the depend on the individual immunity can affect the COVID-19 infections.
Right. Now, Professor Song, it's your first time on our show. Perhaps you could start with a few words, that is, on the current global health crisis led by COVID-19.
Well, for COVID-19, I didn't really expect this pandemic to take this long. And as a sleep specialist, I do worry about the virus itself, but I am more worried and concerned about all the behavior, environmental, mood changes we have to go through during the pandemic. Inactivity, reduced social gatherings, stay-home orders, all the online meetings, increase in screen time, taking care of homeschooling kids, work loss, anxiety, depression, financial stresses. Most of us have to face changes, not one by one, but in package. So this package significantly disturbs healthy sleep.
Right. And Professor Song, I understand you've delved extensively into sleep science, which is why I ask you this next question. Now, there's a local proverb that highlights the importance of the healing power of sleep. It's loosely translated as sleep is the best medicine. Having said that, what or how does a lack of sleep affect our immune system?
Well, I need a very long time to explain everything, but sleep disturbances, especially during this hot summer, is a yearly event that we face. The key problem is that when we wind down to sleep, the body temperature needs to drop. But hot weather disturbances this process. For some, it may be 1 or 2 nights of toss and toss. But for patients who already have unstable sleep, we are much vulnerable to have bites all night to sleep. So hot summer nights, what we are having today, on top of COVID-19 pandemic, brings me concern about studies that sleep releases immune cytokines to help recover from sick, improves the effects of vaccination, and help strengthen the immune memory. Studies of vaccination on hepatitis and swine flu have found that when people don't sleep the night after receiving a vaccination, the body's immune response is weaker, and in some cases, it may reduce the vaccine's protection, which means on top of all this hot weather and COVID pandemic, we don't get quality of sleep or enough sleep may lead to for you to get and a risk of having a sick, get more sick, and also affect how fast you recover from sickness.
I see. So it's very important to get a good night's rest after your vaccination.
Yes, of course.
Right, and keeping that in mind, Dr. Kulmar, what is the importance now of our respective immune systems in response to infectious diseases?
Yeah, I mean, our immune system is critical to fight off those dangerous pathogens such as SARS-CoV-2. Our immune system consists of, there's 2 different types of immunity. We have our innate immunity, which is our natural host, our natural skin that just protects us from any foreign substances. And then we also have our specific immunity, which is B cells, which the lay individuals may know as antibodies, as well as T cells. And it's so critical for our immune system, particularly our B cells and T cells, which I describe as soldiers, to really fight against pathogens, against these infectious diseases, and protect us and be our protector.
Right. And keeping in mind what Dr. Kulmar has just said, Professor Yu, is there a way to check the strength of one's immune system?
I hope we can, but we cannot. So because Dr. Lamina, she explained very well about T cell, the B cell, the immune defense systems. But professionally, we can explain it, but generally, we don't understand what is T, what is B, exactly expressed on our body. But you know what? We have an experience. When Monday we started, after the long weekend, we sort of feel very fatigued. But that time, we feel our lips are a little bit annoying. Yes, blister gets started. So blisters of lips mean it could be our under-nutrition or out of balance of nutrition, but can be out of balance of your immune systems. Skin is the window of your bodies. This can be reflected over immune system. Also, falling hair, it can be your immune system go down. The weight loss can be. But so immune system, we cannot say exactly what's going on our bodies. So if you have a suspicious something, please contact your local doctors and your home family pediatrician. She will say what's going on exactly your immune systems.
Oh, I see. So it's better to reach out for medical advice then?
Yes.
Dr. Kullar, your society, that is the Infectious Diseases Society of America, recently claimed the Delta variant has pushed the herd immunity threshold to over 80%. Do you care to elaborate?
Yeah, definitely. I mean, if we first of all just take a step back and define what is herd immunity. Herd immunity is the number of individuals which are needed to get vaccinated to protect the overall population. So now with this Delta variant here, which is much more contagious, much more transmissible, we know that those individuals that harbor the Delta variant carry about 1,000 times more of the viral load than those individuals that carry that original Wuhan strain. There's just going to be needed more protection. So there's going to be more people which are needed to be vaccinated. The original number was about 70%. Now this number is projected that we need at least 80 or even 90% of people vaccinated to achieve that overall protection. To put this number in perspective, what I consider a very contagious virus is measles. You need a 95% herd immunity level to develop a protection for the entire population. We are very close to that. We're at 80 to 90, even 90% for this Delta variant.
I see. Professor Yu, is there a difference between vaccine-induced immunity and that which follows COVID-19 infection?
Well, recently we got the news from India. India, they are having many people got immunity because of the COVID-19 itself infected. So we still the research about which is better, but we have experience before what Dr. Kola mentioned about the measles. Measles, who got measles, they are very less chance of measles, but meanwhile they got the measles first time, it can be complicated on their bodies. So let's back to the before in H1N1 in 2009. People are naturally immunized with the H1N1 virus, but they still need every year booster vaccination. We can call seasonal vaccinations for the flu every year. So let's back to India. India, they done some percent of vaccination. Yes, they got it. Neutralized antibody. It's the artificial antibodies fight against and make the defense against COVID-19. But naturally infected the COVID-19 condition, this will help to fight against COVID-19. Still, we have some questions. Why is that strong enough? Or how long does it work? It's like vaccination. We still have a question. So our suggestion is, who had got it, but naturally infected and fully recover? American CDC and KCDCA in Korea, we recommend, yes, vaccination should be done.
I see. Dr. Kolar, what has been shared about the risks of COVID-19 reinfection?
Yeah, I mean, what we're seeing in individuals that have been vaccinated, especially in those communities where there's such a low level of individuals which are vaccinated and the case number is quite high, so the burden's very high, is that there's been cases of breakthrough infections where those individuals which are vaccinated get a reinfection. But on the positive side is what we've seen in those individuals which are vaccinated, that they have a less of a serious form of COVID-19 infection. But overall, I mean, the equation is if you're in a community where there's a low number of individuals which are vaccinated and the burden is quite high, your probability of getting reinfected can be quite high. And that's very concerning.
I see. Professor Song, back to the importance of sleep now. Yes. The pandemic has been affecting our sleep and it's led to the birth of a new term, coronasomnia, yes, I believe. How do you explain this phenomenon?
Coronasomnia is a combination word for coronavirus and insomnia. So there's not really an exact term and definition for it, but we use this term for any sleep disorders during the pandemic period. But among various sleep disorders, because we are seeing lots of insomnia patients, it became the origin of the word combining insomnia with the coronavirus. It is not the virus itself that's causing the sleep problem. It's the changes in daily routine and environments because of COVID-19 pandemics, which disturbs sleep. During the pandemic, although there are variations in the degree of a lockdown, we experienced lockdown, stay-home orders, and social distancing in most of the countries around the world. This led to loss of time cue, which functions as daily alarm clock. For example, designated time to show up for work, regular lunch breaks, or regular sleep time. These routines are the external time cue to maintain our circadian rhythm. These routines of the circadian time cue to maintain the circadian rhythm has been really disrupted during this lockdown period. So this further disrupted our sleeps, and not to mention the anxiety, depressive moods, and stress coming from work loss and unpredictability. We are in this unpredictable world, so all this combined has aggravated the sleep disturbances for the normal patients, including and for insomnia patients also.
I see. Now, aside from the obvious symptom of not being able to get some quality sleep, Professor Song, what are some other signs that you are suffering from coronasomnia, and what are the treatment options available?
Yes, It seems like a special term, but it stands with most of the definition of the insomnia. So hard to fall asleep, difficulty maintaining sleep, and having a stress levels, and increased symptoms of anxiety and depression, and intrusive thoughts, and delaying sleep schedules. Because we don't have to get up early in the morning for the work, people are delaying. It's usually about average of 30 minutes we're delaying our sleeps. And as a consequences, we have these daytime symptoms of sleepiness, cognitive changes, and focusing problems, and mood changes. It is clearly seen from the research and clinic that the insomnia incidence have been increased, but the number can be varied depending on what studies we're looking at. But it can range from 4% to 37%, which was reported in China based on the Hubei province, which was the first area that we experienced the COVID-19. So this increase in rate in insomnia has been seen in worldwide changes. And for the treatment, I would like to recommend that reinitiate the routines that you usually have. So stick to the similar behavior routines, including sleep consistency, get your daylight doses of sunlight, and make sure you go to bed at the dark, quiet, and cool circumstances, which includes no using cell phones, and reduce their screen time on your bed.
Right. And staying with treatment options, Dr. Song, what are your thoughts on the consumption of sleeping pills?
It's a very tricky question. I do use sleeping pills, but it could be a really good choice for some of the patients. But we do have to consider the consequences of using the sleep pills. For example, addiction potential, hangover in the morning, decline in cognitive function, and injuries. So all these insomnia patients would like to have the sleeping pills. They are very concerned of the side effects they have. It should be used for indicated insomnia patients with a very tight scheduling. So it's not really recommended for most of the patients, in my opinion. And there is other options, and we call this non-pharmacological treatment for insomnia, which is cognitive behavior therapy, which is actually the first-line treatment for the chronic insomnia. So maybe you should consult your doctor before you start your sleep pills.
I see. Meanwhile, back over in the US, Dr. Kolar, there is talk about booster shots for the elderly and those with weak immune systems. Could you tell us a bit more about the latter group and how effective will these extra shots be for them?
Yeah, the CDC, the NIH, and the FDA are in the talks about these booster doses. And essentially, what these booster doses do is that they help an individual develop more antibodies and protect them more. And those individuals which you talked about, which are immunosuppressed, and that encompasses those which have cancer, which are on immunosuppressive agents, such as transplant patients, their immune system is already going to be weaker. And so their antibodies may have dwindled over time from the time that they received their vaccine. And so this is a population through some studies that have been published through Pfizer, through Moderna, through AstraZeneca, where this population may actually benefit from getting a booster dose. And this population, they're going to need that booster dose to really get added protection. And in addition to the elderly, where those individuals which are over the age of 65, they may need a booster dose as well.
I see. Professor, you're back here in the country. Those in their 30s account for the majority of breakthrough infections, something that Dr. Kolar touched upon earlier. How do you explain this finding?
Well, before we move these themes, I'd like to talk about what is the breakthrough infection. Breakthrough infection is it serious? I can say not. Why? We have an experience already. So many people are inoculated, national level of inoculation of the seasonal flu. Yes, we done last year as well, but we got flu. So this was serious? Not. Why? Breakthrough infections mean, yes, some of the weak points who are even immunized or inoculated, but it can be happen in the infected. But these days, these surgeries in Korea have, and the States as well, having the breakthrough cases reported, because we must see range of their activities compared to 70 years old or more. So the more young people are range of activities and move around in the communities, they have more opportunity to have infected. That's why they are more breakthrough infectious cases. This is kind of the era or the kind of tip of the vision about the statistics difference. So don't worry about it.
Right. Dr. Kalar, what are your thoughts on COVID-19 becoming endemic?
Yeah, I mean, I think it's going to take a combination approach. It's going to take a multi-layer approach in terms of there being people wearing masks, in terms of there being enough people that are vaccinated, in terms of the numbers coming down. So in order for this pandemic to really change and shift, there has to be a combined approach here, and everyone has to work together. I see this virus as an enemy, and the only way for all of us to tackle this enemy is to work together with the infection prevention measures that we know have worked and vaccinations, which we know work quite well against this deadly virus.
Right. Dr. Kalar, just out of curiosity, you spoke about a multi-layer approach to addressing the pandemic. Where do you stand on the debate with regard to face masks for those who have been vaccinated?
Yeah, I'm extremely conservative, so I believe that face masks should be used whether you're in an area which is of high, where there's a high rate of cases, or there's also a moderate rate, because you're going to be around those individuals which may be unvaccinated, and you may have a high probability of then carrying that virus. The way we know that this Delta variant works is that it is quite concerning. It's quite contagious, and you don't want to be the one to pass it on to somebody else. So I believe that everybody should be wearing a face mask indoors, as well as getting vaccinated. And that combined multi-layer approach is what's needed to tackle this virus.
Right. Professor Yu, what do you advise, meanwhile, as part of efforts to boost our level of immunity against diseases in general?
Well, these days, right after the pandemics, many television shows and commercials show us the supplements for the health. Yes, so these days is the very much of the selected of supplement, but let me say, only one way, the best way to handle against COVID-19 is vaccinations. Vaccination it helps to enforce of your immune system is a boost up. Yes, this is the only way to go to salute this pandemic condition. But otherwise, minor, but we can keep your temperature. So keep your body temperature is one of the best ways, keep on your immune system. This is the many evidence I can tell. The third one is balanced diet and nutrition. And today's topic is the Professor Song, she comments about the good sleep. As you know, shingles or herpes zoster is more happen and diagnosed in the summer times. So the reason because of weather and humidity, but I believe it's not only about it. Yes, short of and the low quality of the sleeping. So good quality of sleep can guarantee, yes, these times Korea Peninsula so hot, humid, but will help you. But best way, don't forget, fully vaccinated first.
Right. Right, Professor Song, what do you propose then to ensure quality sleep amid the pandemic?
Well, it seems like sleep needs to be very important after all this show. My suggestion is that if you're having sleep disturbances during COVID pandemic period, I want you to stop focusing on how am I going to sleep this night. I want you to focus on how aggressively, actively should I stay awake during the daytime, because inactivity, napping, poor light exposure during daytime cannot build up enough sleep pressure for you. So I suggest that you do more exercise, you do more during the daytime for you to get you to sleep at night. But if you have tried everything and cannot sleep enough, maybe you should visit your sleep clinic.
Right. When you talk about light exposure, you're talking about sunlight.
Yes, of course. Yes,
right.
Of course. It's important that we expose ourselves to the sunlight, is because when you expose yourself to the sunlight during before noon, it releases melatonin, which we call a sleep hormone. So it starts to release about 10 hours after the sun exposure. So if you want to have your natural sleeping pill, which is melatonin, that means that you should expose yourself to the sunlight before noontime, which make you easy to go to sleep at night.
I see. All right, Professor Song, thank you very much for your insights. Professor Yu here in the studio, thank you very much for being with us today. And Dr. Kular over in the US, thank you very much for your thoughts.
Thank you.
Right, eat well, sleep well. Now, this adage is quite common within the investment arena when referring to the risk-return trade-off. Well, given today's discussion on the importance of our immune system, I'm sure you'll agree that these simple words of wisdom may be one way to keep the pandemic at bay. Thank you for watching.
Korea has reported a record-breaking number of new COVID-19 cases. The virus is spreading at an alarming rate, especially in the Seoul capital area amongst the younger generation. Consequently, the capital region will be placed under the toughest level 4 curbs. The purpose of level 4 social distancing is to prevent mass outbreaks by minimizing social interactions. Private gatherings will be strictly restricted to up to 4 people until 6 p.m. and no more than 2 after 6 p.m. All rallies and events are prohibited except for one-person protests. Entertainment facilities will remain closed,